We are in our 60th year as an independent nation. But are we collectively standing up for justice, brotherhood and peace? Are we working diligently and creatively so that Jamaica may, under God, increase in beauty, fellowship and prosperity and advance as a nation? Let us each day not only consider these things, but act upon them to ensure this piece of rock remains Jamaica land we love. Let us each do right by our country, for others and for ourselves. You're watching Jamaica Magazine, and I'm Adrian Atkinson.
On our roads, remember, take time, be courteous, drive good, walk good. Part of keeping our roads safe is ensuring the vehicles we drive are mechanically safe, meeting all roadworthy requirements. And besides that, we must be good drivers and avoid risk-taking and sensation-seeking behaviors which are prone to causing road crashes.
Good day, I'm Theodore Henry, and this is your JIS News for Thursday, January 13, 2022. The long-awaited Tourism Workers Pension Scheme has now been officially launched for hundreds of thousands of Jamaicans employed in the industry directly or indirectly. It was launched at the Montego Bay Convention Center yesterday by Minister of Tourism Edmund Bartlett. He says this is a historic first for Jamaica as well as the rest of the world, pointing out that while most other pension plans relate to different companies or entities, this scheme embraces all workers, entrepreneurs, and stakeholders.
There is no other country in the world that has a comprehensive tourism workers pension plan. No other country in the world. Jamaica is the first country in the world to have this plan.
The Tourism Workers Pension Scheme was rolled out with Guardian Life as fund administrators and Sagicor Group Jamaica as fund managers. More than half of the $1 billion seed money provided by the government of Jamaica has already been dispersed to the scheme. Participants in the plan are protected by state legislation, with the Financial Services Commission managing the surveillance and regulatory framework to safeguard against breaches and unscrupulous behavior. Also, a tourism worker is to be included on the scheme's board of trustees. Minister Bartlett says the pension fund could become $1 trillion in 10 years, making it a game changer and huge bit of economic initiative.
And I could see the impact in the years, not only of providing the social safety net for the workers that are so badly needed, but also provide, as I said, a pool of critical capital for growth and development, not just in Jamaica, but indeed in the Caribbean.
The Kingston and St. Andrew Municipal Corporation, KSAMC, will be making several changes to its planning, permission and building approval processes to make it far more efficient, transparent and accountable. Mayor of Kingston, Senator Councillor Delroy Williams, made the disclosure Tuesday at the KSAMC's first monthly meeting of the new year.
We are bent on improving the process and finding opportunities for improvement. This leadership of the council is not interested in grandstanding and in knee-jerk reaction. We are seeking solutions for a sector that is critical to the city's economy.
Some amendments have already been made to include the posting of all approved and refused applications on the corporation's website. An information and communications technology-based complaint system has been implemented. Mayor Williams adds that the chief engineer must now submit a detailed list of all building works and their status on the last working day of each month. And there will now be mandatory inspections every 3 months for every development and designated stages of completion. Letters have been sent to the Prime Minister and the Ministries of Local Government and Finance recommending procedural and legislative changes in the KSAMC as well as other ministries and municipalities that impact the approval processes. The Ministry of Education is working with eLearning Jamaica to procure a total of 42,311 tablets and laptop devices. These will be distributed among lower primary and secondary students.
eLearning Jamaica Limited has already procured 11,500 tablets and is presently preparing to start the distribution to lower secondary school students in the rural schools across the island. This will help to significantly reduce, as we know, the digital divide. We've had a significant effort on that.
The Education Minister says that to date, approximately 130,000 tablets and laptops have been distributed to teachers and students, with special focus on students enrolled on the Program of Advancement through Health and Education PATH.
As a government, we will continue with the many initiatives started last year to get to our goal of a device in the hands of every student in Jamaica to help the learning process.
The Education Ministry will continue to provide audiovisual lessons via the Public Broadcasting Corporation of Jamaica, PBCJ, and the Ministry's 2 new channels through the eHome School Network. Meanwhile, as at January 10, approximately 954 of the 983 primary and high schools have been approved as COVID-19 compliant by the Ministry of Health and Wellness. The update came from Education Minister Favour Williams in an address to Parliament on Tuesday. Minister Williams explains that a COVID-compliant school has wash stations or sinks where the children have easy access to wash their hands, distance markers to make the students aware of how far apart to stand or sit from each other, and an isolation room with its own bathroom facilities.
In this environment of the new Omicron virus, our priority is to keep our children as safe as we can while they are in the school environment.
A guide for the reopening of educational institutions called the Emergencies in Education Manual is on its 3rd version. It was published at the start of the pandemic and distributed electronically to all principals.
There's also a section dealing with the National School Learning and Intervention Plan, responsibilities of school administrative staff, responsibilities of parents. So, Madam Speaker, we have been taking care to ensure that we disseminate information to our principals or teachers to help them to manage during this COVID pandemic.
And finally, Jamaica's Chief Medical Officer, Dr. Jacqueline Bisese McKenzie, is advising persons to remain at home and monitor themselves if they develop mild flu-like symptoms. If symptoms worsen or persist beyond 3 days, or you have a chronic illness, medical advice should be sought from a private or public health doctor.
This can be from your private practitioner, from the health center, or from the parish health department.
The CMO points out that persons may be advised to do a COVID-19 test, which can be done privately or in the public health system by referral.
A list of public health testing sites is available on the Ministry of Health and Wellness's website. Persons with severe symptoms should seek immediate medical attention.
The health advisory comes as the country is going through a 4th wave of COVID-19 infections as well as the flu season. To prevent infections, all persons are encouraged to frequently wash their hands, wear a mask, get vaccinated, take a booster if it's due, observe physical distance, avoid crowded spaces, stay hydrated, exercise regularly, and eat healthy. And that's it for JIS News Today. I'm Theodore Henry. Thanks for watching.
What a way you're full of our roots and culture. That was in Jamaica 60. Jamaica 60? What a piece of news, Miss Matty. I feel like my heart going bust up.
Just in, the island of Jamaica is on the verge of celebrating its 60th year of independence.
A whole way of celebrating it. They say the people them, you know, them come here, you know. But you see, when our people decide, say the other people them free paper, burn up, them say if it's war, start it, whatever. We all collect medal, panta, you know.
Medal.
Amount of
The celebrations are slated to begin on January 1st, 2022. Organized by the Ministry of Culture, Gender, Entertainment and Sport. We have more in this report.
I am on site and planning activities are ablaze. Persons are advised to download the Reggae Jamaica app to know what it pre. Activities for the Jamaica 60 celebration.
Download the app to get the updates then.
It's time to look at some of the major high points from the Ministry of Health and Wellness in 2021.
2021 was another extraordinary year for public health, where the Ministry of Health and Wellness rolled out multiple strategies to keep the country safe and build resilience against the current and future global pandemics, all while improving access to quality care in the public health sector. After much preparation and planning, Jamaica received its first batch of COVID-19 vaccines in March 2021, and the Ministry of Health and Wellness immediately commenced priority of vaccination of the population, targeting 440,000 persons, including frontline workers and the most vulnerable in its first phase.
Through vaccination of the elderly, we will immediately cauterize the number of persons who have negative outcomes.
Scores of vaccination sites were set up, and various mass vaccination blitzes as well as house-to-house interventions conducted, as the ministry built momentum towards the overall target of vaccinating 65% of the population by March 2022. And by year-end, with 4 brands available, over 1 million doses of COVID-19 vaccines had been administered. $10.5 billion was approved in budgeted allocation to support the COVID-19 response, including financing the cost of vaccines and vaccine deployment and implementation. Additionally, an agreement was signed with the United Nations Children's Fund, UNICEF, for the deployment of a vaccination management system software with registration and scheduling modules that enabled seamless scheduling of online vaccination appointments via the ministry's website and via telephone. The National Vaccination Program also received over 400 tablets, computers, and other electronic devices as part of an $11 million support package from the private sector of Jamaica's vaccination initiative. In 2021, the Ministry of Health and Wellness also contracted call center company ITEL BPO Smart Solutions to manage the telephone aspect of the vaccination registration and appointment process. An MOU was signed for a public-private partnership to accelerate the procurement and administration of COVID-19 vaccines in persons in these sectors.
This MOU allows us to move through these groups a lot quicker.
Healthcare workers from several private hospitals and school nurses were trained and approved in key areas of vaccine administration, while a number of private entities were contracted to administer the vaccine free of cost and carry out COVID-19 testing.
This is another case of us working together as a team, as a country, in order to protect our population.
The last 12 months also saw public health benefiting from several donations from corporate Jamaica and international partners to support the pandemic response. As the ministry focused resources on upgrading public health infrastructure last year, a new state-of-the-art elevator was commissioned at the Victoria Jubilee Hospital.
We've now been able to have 2 working elevators.
Also in 2021, approval was granted by Cabinet, awarding a contract to provide 3 X-ray machines to the Kingston Public Hospital and 1 each to the Spanish Town, National Chest, and the Bustamante Hospital for Children at a cost of $453.4 million. Ground was broken for a multi-story parent overnight suite and wards at the Bustamante Hospital for Children, while a new pharmacy was opened at the hospital. Digital health care was also part of the expansion mode last year, as the Ministry of Health and Wellness signed a contract for an ICT health system strengthening program with Cable and Wireless Jamaica Limited.
This is game-changing
Work also took place to complete the construction of the Adelphi Health Center in St. James, while upgrading work was completed on the Flanker Health Center. The Ministry of Health and Wellness signed a contract in November with the construction firm M&M Jamaica Limited to carry out the penultimate phase of the work at the Cornwall Regional Hospital at a cost of close to $1.7 billion. Government's efforts to upgrade public health infrastructure were also supported by the Adopt a Clinic initiative in 2021. The ophthalmology department at the Bustamante Hospital for Children last year received a donation of examination equipment for early detection and treatment of abnormal eye conditions and diseases. A new operating theatre bed was gifted to the Percy Junior Hospital in Manchester. The country's disease surveillance and health research capacity was significantly strengthened in 2021 with the acquisition of the country's first genome sequencing machine. The country also made advances in 2021 towards meeting the refocused and reprioritized UN-AIDS 1990 target with the introduction of self-test kits for persons to conduct their own HIV test.
With our a rapid antibody test kit, the power is literally now in your hands.
As part of the wellness agenda last year, the ministry launched a research study on the knowledge, attitudes and practices of salt consumption among the population. A national committee on NCDs was launched in the past year to review and make recommendations to the ministry and stakeholders on policies, laws and programs related to NCDs. In its further support for healthy lifestyles and NCDs prevention in 2021, the ministry launched a pilot software application called JA Moves on the Move. The first set of reach-out rangers to help individuals in community facing challenges amidst COVID-19 were appointed in 2021. These were just some of the activities in the Ministry of Health and Wellness in 2021, building resilience in public health, establishing pillars that will support national growth and development as the country recovers stronger from the COVID-19 pandemic.
A few questions are being asked in relation to the COVID-19 vaccine. A big one is, why do immunocompromised persons need a third dose of the serum, and who falls in this category? The country's Chief Medical Officer, Dr. Jacqueline Bisesa McKenzie, shares the answers.
There are some questions that have been asked, and I'm using this opportunity to provide some of the answers with regards to the vaccine. First of all, much of what I have to say is coming from advice from the SAGE committee, and I just want to say that the SAGE, or Strategic Advisory Group of Experts on Immunization, was established by the Director General of the World Health Organization in 1999 to provide guidance on the work of WHO in respect of immunizations. SAGE is the principal advisory group to WHO for vaccines and immunizations, and it is charged with advising the WHO on overall global policies and strategies ranging from vaccines and technology research and development to delivery of immunizations and its linkages with other health interventions. So some of the questions asked. The additional dose for the immunocompromised. And here we have to make a difference, to make a distinction between an additional dose of a vaccine versus a booster. So an additional dose of a vaccine is given if we think that the persons having received the primary immunization have not mounted an adequate response. So the SAGE committee met October 4th to 7th And coming out of that, they have recommended that moderately and severely immunocompromised persons should be offered an additional dose of WHO emergency use listing COVID-19 vaccines as part of an extended primary series, since these individuals are less likely to respond adequately to vaccination following a standard primary vaccine series and are at high risk of severe COVID-19 disease. Now, the group of persons considered immunocompromised, so far the information that we have, transplant patients, patients with active cancers, persons on chronic dialysis, persons with severe primary immunosuppressive disorders, AIDS patients with cell counts less than 200, and persons on immunosuppressants for other disorders, such as high-dose steroids and methotrexate. Now, persons to which this applies are asked to obtain a letter from their physician to verify this, and the physicians who treat these special populations are also asked to contact the health departments and to submit the names of their clients so that we can make arrangements in the appropriate time period for this third dose to be delivered. And we will provide further updates through press releases. The other issue is in terms of booster doses. And remember now what I've spoken about before is an additional dose. This now is a booster dose. So this is where persons would have developed an immune response, but over time the immune response would have waned. Now, and they are given boosters. This is common in our immunization programs that we do for our children. Many of our childhood vaccines are given boosters. Now, at this time, there is no recommendation supporting boosters that is coming from the WHO. And the emphasis is on the administration of primary doses to as many persons as possible. Now, the vaccines continue to show high levels of protection against severe illness, hospitalizations, and deaths after primary immunization, and also against the variants. And this is why there is no recommendation, and I must emphasize at this time, because we know that as time passes and more studies are done, then persons do want to ensure that boosters are given at the appropriate time. But right now, the vaccines have been shown to be holding up, and so there is no necessity at this time for the booster. The other question is in terms of the mixing of vaccines. And again, I have to say at this time, there is no recommendation for the mixing of vaccines. The recommendation from the WHO is to take the same vaccine as your second dose.
Time cannot be spent dilly-dallying about giving assistance to the poor and the needy.
The Ministry of Labour and Social Security, on its mandate to protect the labour force and to provide social security for the poor and vulnerable, was steadfast in helping to mobilise the mission of recovering stronger together in 2021. Watch Jamaica Magazine on Friday, January 14, as our Year in Review series continues with a look at activities in the labour and social security portfolio.
Up next, understanding wildlife and our responsibility to protect them.
There are increasing threats to Jamaica's biological resources, like our plants or animals, due to events like habitat degradation or pollution. And globally, cycles like animal poaching to fuel a thriving fashion industry continues to hover over the idea of sustainable life in the wild. While Jamaica and the rest of the world's ecological challenges of today need innovative solutions, understanding our wildlife, what to protect, the need to protect it, and those mobilized to protect it is one of the biggest starts.
The overall goal for wildlife conservation is really to try and preserve a particular species in its natural environment. So the species that are protected, how do we determine those? Well, Jamaica, again, as an island, has a lot of unique species. So that's one of the first things we look at. What are the things that are unique to Jamaica? What are the things that are endemic? So we're looking at endemic species, not just animals, but also plants. And we are trying to see how we can ensure that we don't lose those species. There are also species whose numbers are very small. They're not necessarily endemic. Some of them are more widespread, but their species in Jamaica are very small and they may have a higher threat of exploitation, for example. Persons are going to try and harvest them. And so we try to put some form of control onto the amount of harvest that is done. So in order to do that, we have to bring those species under the Wildlife Protection Act so we can better regulate these activities.
So how do we necessarily choose which animals fall under the country's Wildlife Protection Act?
Now, how do we choose these? Well, we look at what is native, what is endemic, and then we actually do surveys. We look at what the population numbers are like. We also signatory to several international treaties that actually tell us that certain species that we have on our island are actually endangered, critically endangered on a global scale. And so we have to play our part here in Jamaica to ensure that those species are not lost.
And then there is the issue of domesticated animals, those that are dependent on humans, because over time they have become genetically adopted to live alongside us. But more and more persons are stepping into the wild for new breeds to domesticate. But disturbing that pattern can have implications.
Domesticated animals are really animals that are very dependent on man and very used to habitualize to man. And so we talk about cats and dogs, some pigeons, for example, your rock pigeons, your everyday domestic pigeons. Those are domestic animals. Now, some of our wildlife persons would like to keep as pet. They are not domesticated animals. They are actually wild animals. Our parrots, for example, we have two endemic species of parrot, the yellow-billed parrot and the black-billed parrot, and persons would tend to want to keep those as pet. And they are actually protected because their population is low. First off, they're endemic. Their population is very low, and their population is also declining. And so we're trying to protect those species.
From around August to somewhere in September, our bird shooting season is a welcome activity. But even these licensed activities, the National Environment and Planning Agency NEPA is regulating how we protect our endemic species in the wild.
We have hunting season, that is something that is actually regulated. NEPA also declares what are known as game reserves. And game reserves are areas where we do not want any hunting activity to occur. Because annually we have annual game bird hunting season, and so we have game reserves to protect populations, especially breeding populations of these birds, so that they are not overexploited. So game reserves are areas where no one is allowed to hunt, and we actually created a law in such a way that all forest reserves that are managed by Forestry Department are actually, in effect, game reserves as well. So in that sense, NEPA does have a role in forest reserves in ensuring that no hunting occurs within forest reserves.
So, next time you roam our rugged landscape, or pass by the carpet of plants lining the roadways, the thick tangles of bushes, or observe the colony of birds or seemingly baleful mongoose, let's observe without disturbing those patterns of life.
This is where our journey ends, but only for today. Do join us again tomorrow when we'll bring you another informative program. In the meantime, stay connected via our website, jis.gov.jm. And while you're online, send your feedback to Jamaica Magazine@jis.gov.jm or via tweet at JIS News. You may also find us on all the major social media platforms and through our mobile app that's Android and iOS compatible. On behalf of the entire production crew, I'm Adrian Atkinson. Do take care.
This has been a production of the Jamaica Information Service, the voice of Jamaica.